All right, next question. This is from Kristen. Hello. Yeah. So, it's the question is, what are your thoughts on this treatment? And it's something from TexasHillCountry.com. All the best fossils are out in Texas Hill Country, I've got to say. So I'm kind of a fan, yeah, of the area and the wildflowers. I caught a little bit of the tail end of them like 2 weeks ago. They're always so pretty in that area. It's just, yeah, it's a really cool looking area of the country. Gotta say, probably my favorite bit of Texas so far. Although the beach is nice too, but I don't know. This is inland for inland Texas. This is it beats all. Okay, so what's the article? The article is about um, a doctor who is trying out an inhaled steroid called budesonide, which I've never heard of. But all right, inhaled steroid. What's the idea there? This would be something that would try to block some of the immune response that gets out of hand and causes the damage in COVID. So there's a reasonable mechanism for how this thing could work. I don't know whether it does work or not, though. You'd want to see the paper. So the doctor's saying that he's treated a bunch of patients, and I'm not sure if he says the exact number of patients in there, but he's got a 100% survival rate. Thing is, this virus kills something like 1% of people, and of hospitalized people, it's something like 3, 4, 5%, somewhere in there. It depends on where you are exactly. And so it's a coin flip test, but one where the coin is going to come heads up, like the person living, somewhere between 99% and maybe 90% of the time. And so the question is, how many coin flips do you have to have when you got this weird weighted coin before you can actually say that, yeah, it definitely makes a difference? I think the answer is going to be somewhere in the hundreds of patients. And I don't know that there's any way that a doctor in, I thought they were somewhere by Midland, Odessa, yeah, would have seen that many patients personally and been able to give this treatment. So it's a thing that might work and would probably benefit from a wider clinical trial. And yeah, I don't know, I'm all for clinical trials. This one at least has a good mechanism where it would make sense if it worked at least some. But the things you would look for would be you would want to look and see the amount of the immune response. Would want to see that there's a difference between the people you've treated with this and the people that haven't been treated with this. That one group has more macrophage activation or more inflammatory markers or more damage due to this, or better yet, like all those things put together. You want to read out like a cytokine panel from each of these people. That costs a lot of money. Insurance isn't going to pay for that, so that's the kind of thing that you need some kind of grant from the hospital or from some funding agency to be able to really do. And that may be what's, the reason why this isn't fully fleshed out test and is just an interesting idea. But yeah, sounds interesting. Now the other part of the treatment is apparently zinc. And the zinc thing is something, this is like old wives' tale science, which is not science at all. In other words, zinc is very widely used in uracils and in some virus proteins, and changing zinc levels would have a much greater effect on the rest of the body than the virus, and I don't think you can meaningfully do anything with zinc. If zinc was an immunosuppressive, and stop the disease, it would have a giant warning label on the side of those little pills, which it doesn't because it's not. And if zinc was able to be like inside of a human body, if it was the magic bullet or silver bullet or whatever Lone Ranger thing we're calling this, then there have been tests that have looked at zinc and shown that it makes very little to no difference in various viruses. And so I don't think, I don't think there's a specific reason why that would work or that it would even, yeah, have a way to be effective. But yeah, as for the steroid, maybe. Immunosuppressive steroids, those are pretty widely known. And yeah, I don't know anything about this one. I'll look it up after. But yeah, could be good. So at least half good, maybe. Yeah, but it needs a bigger test. There we go. Thanks very much. This is Ask Dr.